Hello guys, today we are diving into the fascinating world of Horner syndrome in cats and dogs. We'll explore what it is, why it happens, and how it can be treated. Let's get started. Horner syndrome can be caused by a variety of underlying problems, but it is not painful in and of itself. Usually it will resolve on its own with resolution of its primary cause. What are signs of Horner syndrome? Ptosis, dropping of the upper eyelid. Miosis, constriction of the pupil leading to mismatched pupil sizes. Anhidrosis, reduced or absent sweating on the affected side of the face. Anhidrosis, the eye appears sunken into the orbit. Facial flushing, redness on the affected side due to blood vessel dilation. Loss of ciliospinal reflex, a diminished response in pupil dilation when the neck is stimulated. Heterochromia iridum, in congenital cases, a difference in eye color between the two eyes. Horner syndrome usually only affects one eye, but can occur in both at the same time. On this slide, you will find additional images to help deepen your understanding of the topic. But why it happens? When we talk about Horner syndrome, it all comes down to the nervous system. The sympathetic nervous system, that is responsible for the body's fight or flight response, play a key role in keeping the eyes alert by opening the eyelids wide, dilating the pupils, and keeping the eyes forward. Horner syndrome occurs when this system is disrupted. As a result, your cat's or dog's eye might sink back into the socket. The third eyelid may partially cover the eye. The upper eyelid can drop, and the pupil might appear smaller than usual. It's like the eye going into rest mode because the signals to stay alert aren't working. Does it affect any particular breed or age of dogs? Horner syndrome can affect dogs of any breed or age. However, certain breeds like Golden Retrievers, Labrador Retrievers, Shetland Sheepdogs, Weimaraners, Doberman Pinschers, and Collies tend to experience it more often. Horner syndrome can also affect cats, but it's less common compared to dogs. In cats, the condition is often linked to an underlying cause, such as trauma, bite wounds, ear infections, or tumors affecting the sympathetic nervous system. Unlike dogs, idiopathic Horner syndrome is rare in cats. What is the treatment? Horner syndrome has no direct treatment since it's typically caused by various underlying issues. The approach focuses on addressing the root cause. If the issue stems from trauma, medications for pain and inflammation may be used and surgery might stabilize damage. Infections are treated with topical, oral, or injectable antimicrobials. Inflammation affecting the sympathetic nervous system may be managed using anti-inflammatory drugs. In case of a tumor, surgical removal might be recommended if feasible. In some instances, no cause is identified, which can be frustrating. However, Horner syndrome might resolve on its own over time. If symptoms persist beyond 6 months, resolution becomes unlikely. For diagnostic, veterinarians use eye and ear exams, radiographs, CT scans, MRIs, and pharmacologic tests like phenylephrine drops to pinpoint the issue. What is the prognosis and recovery rate? The prognosis for Horner syndrome is quite positive, especially if there is no underlying pathological issue. In such cases, recovery often happens on its own and can take anywhere from a few weeks to 4 months, depending on how severe the condition is. Thank you for watching, guys. Don't forget to like, comment, and subscribe. I really appreciate your support.